Okay, well, that's coming up there. So I'm going to actually talk a little bit around. I know that says mental health on the door there, but I want to actually more broadly talk about health into the employee experience, and some of the thinking that we're having at Medibank. It's not working. So essentially, Medibank is more than a health insurance organisation, and you may or may not know. Can you hear me? Am I actually speaking out there? Yeah, good. Is more than a health insurance organisation. We're really moving into a healthcare organisation. So what you might not know is that we support the 1800 RESPECT call lines across Australia. We have some 700 nurses who are the voices on the end of the phone when members of the public call in, whether it's a 24/7 issue with their child. You usually do have 24/7 issues with your child. So it's more than insurance. It's the health and wellbeing support that we give to the Defence Force across Australia. It's the fact that we've just purchased 2 new acquisitions in the health space, which is delivering healthcare into the home. It's okay, we don't need slides. We're going to go without it. Healthcare into the home. And so the conversation we've been having at Medibank is really around how do we create a customer experience of health for everything we do? How do we put a health conversation at the centre? And so then we started thinking, well, why would we do that just for our customers? We should be doing that for our employees. So that every interaction we have, we think from a human lens, but we also think from a health lens. The opportunities in that are pretty big, but we need to be bold as a profession in how we address that in the future. So some of the stuff that we are doing now, and some of it's kind of futuristic in my mind about what this might look like, it would require us to think differently about, I guess, the pathways of care, whether it's from workers' compensation, whether it's from salary continuance, whether it's from TAC, victims of crime, whether it's absenteeism generally. We need to actually start thinking differently about the person at the centre and what support they need, and not just thinking of it as where the money's going to come from. Sorry? No, now I've got to do something. There I am again. In my ball gown. So I guess I'm going to challenge you a little bit to start thinking about the lens that you put on healthcare. So that's just a little bit about us that I've already given you that blurb. But we really are starting to grow into the health space. Internally, from an employee health and wellbeing perspective, we recognise that every individual needs choices and that one size does not fit all. We also know that wellbeing is not programmatic. It has to be holistic and it has to come from the DNA of an organisation. Importantly, we know everyone has a story, and I'm sorry there are some people in this room who already know this part of it, but there are people who don't. So just for now, consider this. Everyone in this room has a story. Every one of your people has a story. Everyone in the community has a story. This is my story. I grew up in a little town called Seymour. I lived in a commission area. Every night we'd come in when the lights went off because we were hungry and it was dark. But other than that, we pretty much just hung out as a group of kids supporting each other. Every night I'd go home, and I didn't know this, but my house was a little bit different. I grew up in a house with mental health issues. Mum had anxiety, depression, and agoraphobia. So my house was slightly different. I didn't know that until a bit later. It kind of all started to make sense. I think that shaped me a little bit as I've grown, and it's probably helped me pick my career choices, which is a good thing. And then as I've grown, we moved to Ballarat, which I live there now, and I travel into Melbourne, stay in Melbourne a bit as well. I got married, got a beautiful husband called Jason. He works part-time, he's a nurse. I've got 2 wonderful boys, Angus and Will, 16 and 13, challenging ages. completely different kids. But at that time, I've had to take parental leave. I've had to take time off when they were sick. I've had the challenges of being a parent, as many of you have. I've got 2 chickens, Marjorie and Speckles, and a rescue greyhound called Nessie. Then as I've grown and the kids have grown, my mum then got sick. She got Alzheimer's. She had that for around a decade. She passed away in August this year. So I've been a carer in that time. In amongst all that, I've worked and I've built my career, and I moved to Medibank 6 years ago. So there's no magical wall that separates workplace and life. There just isn't. And whilst ever we continue to think like that, we will never, ever improve the health of the nation or our people, your employees or yourselves. There just isn't a magical wall. It's a very flimsy wall. Last year we released a wellbeing at work index, and we worked with that with Deloitte. And we actually started to think about, well, what are the quadrants of health that we need to create a framework that informs organisations and ourselves around what type of things impact employee health and wellbeing. So we had body, mind, purpose and place. The index, you can Google Wellbeing at Work Index, it'll pop up. And then in the Medibank context, we're starting now to look at that as the personal and the fundamentals. What do we actually do as an organisation that creates a psychologically safe workplace? Because you can't have health and wellbeing, you can't have a mental health strategy, and you can't have a mentally healthy workplace without starting with some basic fundamentals. So for fundamentals for us is thinking about my story and the journey of my employee experience, whether it be at Medibank or other previous employers. I've actually had a career that's navigated around my life. So Flex Better, we brought in a little while ago, and we've just added another one to that, which I'll talk about, starts to think about how do you bring your whole self to work? Because if you can't bring your whole self to work, then don't worry about bringing in running programs, fruit bowls, stairs. It's just not going to work. It's got to start here. So we've got Flex Place, working wherever you want to work. We've got Flex Rosters, Flex Leave, Flex Fit, which is dress how you want to dress and come to work as you want to come to work, within reason. And depending on whether you're customer facing or not that day. But the reality is corporate dress doesn't fit everyone. It doesn't need to. We're all individuals. So inclusion is really important in our dialogue around wellbeing at Medibank. And it's important around our psychological wellbeing at Medibank. We brought in uncapped domestic violence leave and support last year. The amount of feedback that we've had from individuals, not to mention the number of employees who would not have otherwise come forward, has been quite humbling. Because without that leave policy and the ability to talk openly to somebody, they're trying to work and juggle courts, families, moving, name changes. How can we have a healthy and safe workplace and a psychologically well workplace if we don't actually support those people through that process? So we brought in uncapped leave. I note that the Fair Work Commission has just brought in 5 days of unpaid leave as being mandatory in the future. 5 days isn't much, but it's a start. You might have seen, and we're very proud of this, our new parental leave that we brought in. So removing the labels of primary and secondary carer. So, and I can see Alex down the back here as one of my team members. Hey, Alex. Alex is going on parental leave in February. So he'll be taking 3 months off to care for his new son, Leon. And that's fantastic because he gets to actually be part of the growing family that he has. He gets to be responsible as a parent equally as his partner. That's important to wellbeing. That's important to psychological health and wellbeing. And then we have the LGBTI community. I put that up there because it's one of the ones that I always feel quite emotional about, because it's seemingly the small decisions that we make as an organisation about our stance or the way we communicate to our people that create healthy environments. So we know, because of the work that we'd put in around inclusion and diversity in LGBTI, and the fact that we support the Gay Mardi Gras, the Mardi Gras, I don't think they call it the Gay Mardi Gras, the Mardi Gras, the Mardi Gras in Sydney, we know that that sends a message to our people about inclusion. So through the vote, the yes vote across Australia, it was a pretty tough time for some of our folk. And one of the most touching moments I had recently was an employee saying to me, Karen, you know, it might not mean much for some people in this organisation about our conversations around LGBTI, pride and the yes vote, but I have to tell you, it was being able to come to a safe place every day that kept me going, that kept me alive. That's pretty bloody awesome. Well, actually, it's pretty horrible that that was happening in the first place, but it's awesome that workplace was a safe place for them. So think about that when you're thinking about wellbeing. Think about that when you're thinking about the framework of wellbeing and mental health, and how you're going to really impact mental health in your workplace. Because if you aren't thinking broadly like this, you're kind of ticking the boxes of, we've got a strategy, we've got a policy, we've got an EAP, and it's not what it is. It's got to change. The conversation has to change. So from what we would traditionally see, and I know that other organisations have done that. I know, Lou, you've done that in your previous organisation, is change the way we even represent our workers' comp injury management team. We call them the health management team, because really we need to start again changing and not caring about what way they're entering in from illness or injury. We need to start thinking about the individual and how we're going to support that person through that time. And so we do that in a variety of ways, and this is not a sell, but take it if you will. Private health insurance, we've been saying, isn't it fantastic that we have a discount of not a discount, it's a subsidy, careful, APRA. It's a subsidy of 30% for our people. And that's been sitting as a benefit kind of thing. We give you 30% as an employee value proposition. Come in, we give you discount. But really, if you think about it, as an employer, before they even step through the door, we know that if they get injured or ill, non-work related, they have access to choice. They have access to care. They have access to their surgeons. And hopefully that translates into return to work earlier, faster, absenteeism. We know that if they get the best care and the support, their families are supported, that will also increase their ability to return to work. Then as they come through the door in their employee experience and their employee journey, we have access to salary continuance, TPD and life. So we know that if things get tough, we can actually support them. That's a little bit of psychological safety and financial safety as well. And that group manages and works with those individuals equally as they would with any other employee in any other scheme. We have the same stuff that you'd have in early intervention, injury management, early intervention, etc., etc. But my thinking is that we do need to start actually challenging our regulators, g'day Comcare, about even the way that we think about the choices of healthcare for our people. Because if we truly want to make an impact, then this is our opportunity. You know, I was actually talking to a group the other day, going off track here, about shared value. And I don't know whether, have anyone heard about shared value in the community space? There's a couple of nods and there's a couple of non. So in the community CSR, corporate social responsibility space, there's this movement, it's kind of a little bit oldish now, but called shared value. So do something out in the community that brings in financial benefit in return to your organisation. But what you're doing is creating social movement, social change. And I was having this interview with them the other day and I said, you know what, when you think about it, the work that we do with employees, every organisation has an opportunity to have a shared value impact to community, to the health of Australians, to the health of our employees and beyond. But we never really think about that because corporate social responsibility sits over here, benefits sit over there, comp sits there. So we never really bring it all together about what is the impact that we in this room could actually have in terms of not just our workplace, but the broader community impact in terms of health. Because we do know that health is not getting any better for Australians. I've got a really horrible feeling that could be my phone. Chris, could you just turn that? All right, good. So I think this then comes the next conversation of how do we start to push the edges a little bit about who we could use as providers. Do we need EAPs? Can we think about this differently? Can we give people choice? Does it really matter that we collect data here and there? And I'm probably really, you know, there'd be some people in this room going, no, don't say that. Data is king and queen. But the reality is if we really are making a difference on our people, does it really matter? Because ultimately it comes back to those 4 quadrants of health, body, mind, purpose and place, and the connection of our people to us as an organisation and to the broader community. I've got a video to show you. And this is part of our, I guess, challenging the way we deliver healthcare into our members and into the broader community. And this is a story about Liam. And there are other stories because we've been trialling some programs around chemo in the home, dialysis in the home, rehab in the home. Just think about it. Rehab in the home. Rehab in the home, transitioning back to work. Supporting the family. Because we know if you support the family, individuals will return faster. So this is a story about Liam.
Well, the day I showed my mum the lump underneath my arm, it was pretty much filled up to about the size of a cricket ball. The ultrasound was scary. You could just see it in her face. It was figured out that I had Hodgkin's lymphoma. My life got turned on its head within 25 minutes. I mean, I'm 21 years old, it's not fair. My name's Liam Parks. I was an apprentice mechanic. The first time I walked into the cancer ward, it was horrible. I mean, everyone was lovely, but it was confronting. You never have to think about it until you do it. My first round of treatment was in hospital. That was just to make sure that nothing did go wrong. If anything could go wrong, I had the safety net of the hospital. My mum was doing some research, seeing like how could it be made easier. She came across chemo at home. I thought it seems like a good option. For me, having chemo at home it's on my terms. I can wake up 5 minutes before my chemo starts and jump out, roll onto the couch, and then I get plugged in. I just sit and chill out for an hour. With having to go to hospital, that day on your calendar is written off. And you've got 6 months of just doctors, chemo, scans, whatever, it all just keeps stacking up. Being at home, it's much easier. A bit of normality is good. You do have bad days, but you can combat it. Having everyone else around me, that's all you need sometimes, is that little couple-hour break of forgetting you don't have cancer. If I didn't have that, that is where you can just curl up into a ball and give up. I'm very thankful for Medibank and what they've done. Running this program has definitely been an eye-opener, I think, for everyone. That one choice of where you can have it, it's empowering. That's what chemo at home does for me.
It's good to report that Liam is actually doing really well and he's cancer-free. We've got about 3 or 4 videos online if you want to check them out. But what you'll start to notice is through the story of Liam, it's not just Liam that's been impacted. It's his family, his friends, and his dog, and his workplace. So the more we can start thinking about how do we individualise, personalise care for our people as opposed to putting them into a system, I think we can make some really amazing changes. This is what we're doing for our customers. We want to start thinking about what we can do for our employees. So I challenge you to think about what you can do for your people and hope that we can actually shake up the system a little bit with our regulators included. Thank you.